I generally divide nasal blockage or obstruction into two categories, one being structural and one being more mucosal disease. Structural disease generally indicates that there's some bone or cartilage that's not in the correct position, which causes some narrowing of one or both of the nasal cavities, and that can lead to blockage of one or both sides of the nose. Mucosal disease is more of the traditional nasal congestion that you think of. That can be both sides of the nose, it can alternate sides, and that in and of itself can be broken down into things like allergies, other irritants in the nose, things like fragrances, cigarette smoke, noxious chemicals or fumes, even sometimes the environment or things in the air like dust can create some of those symptoms. We really see blockage in the nasal cavities in all age groups. Kids oftentimes have more mucosal disease. Their nasal passages are a little bit more narrow, so congestion from things like allergies or exposure to secondhand smoke can create a lot of swelling of the tissues inside of the nose. That structural disease can live in kids as well, such as large adenoid tissue that can block up the back of the nose, and that can often present as nasal obstruction as well. Adults, I see a lot more structural disease. You have had more time to have things like facial trauma, nasal bone fractures, or just the development of some bone or cartilage that shifted over time that has then started blocking off some nasal passages. In general, patients are coming into the office complaining of difficulty breathing through their nose or a generalized stuffiness in the nose. Sometimes it's actually a lot of postnasal drip or clear drainage that drips out the front of the nose, so it's a wide variety of symptoms. Nasal obstruction can be one side of the nose, it can be both sides of the nose. Sometimes it alternates sides of the nose. And occasionally, patients will come in with complete blockage with inability to pass air in or out of the nose. That's a little more unusual, but the symptoms associated with the nasal drainage are going to be more postnasal drip, constant clearing of the throat, constantly sniffing in through the nose, or a lot of times we'll hear that drippy nose symptom of patients coming in saying their nose just runs like a faucet. Aside from just listening to what the symptoms are, of course the hallmark of the diagnosis is going to be to look inside the nose, and we can look from the front and see the front part of the nose, but ultimately looking further back in the nose, oftentimes with a small camera, can give us the most information about what's going on. That can show us that bone and cartilage on the inside that might be in the wrong position. It can show us swelling of the tissues inside of the nose, and can even give us good information about what's happening in the sinuses if those are involved. Depending on what we see inside of the nose, oftentimes guides our further workup and or treatment of their nasal symptoms. Things like swelling in the nose can lead to allergy testing. Things like deviated nasal septums or evidence of sinus problems can lead to CT scans that might give us more structural information about the sinuses or the bones of the face or the bones of the nose to help us understand where the problem is so we know the best way to treat that. So the range of treatment obviously depends on what the problem is inside of the nose. A lot of nasal problems we can improve with the use of medications, such as allergy medications if there really is a true allergic component to the patient's symptoms. We use a lot of surgery techniques to help with that, especially in fixed structural problems like deviated nasal septums, large swollen turbinates. We can actually take that tissue and make it more anatomically appropriate so that the nasal passages are much more open, air can flow more easily through the nose, and patients have good relief of their nasal obstruction and nasal congestion. Oftentimes they can be curable. Again, it depends on what the problem is, but most patients we can at least make quite a bit better. If there is an obstruction in the nose that we can alleviate, that can be permanent for the patient. If it's something more like chronic allergies or chronic inflammation, that might require longer-term treatment, but ultimately, most of the time we can get good long-term control of symptoms, even if it requires the use of a medication for a longer period of time.